Hello, everyone. I would like to welcome you to the third webinar of the Wastewater Surveillance for Africa Initiative webinar series. So today's presentations are focused on harmonization of wastewater and environmental surveillance in Africa, pathways and opportunities for synergies. Today, we have key presentations to provide input on the progress and development of continental harmonized approaches to wastewater and environmental surveillance in Africa. And specifically, we have the first presentation, which will focus on proposing harmonized approaches of wastewater and environmental surveillance in Africa, universal guidance and identification of opportunities for synergies, which is work led by the United Nations Environment Programme in collaboration with partners. Next, we will have Africa CDC's Continental Wastewater and Environmental Surveillance Strategy for Africa, which will provide an outline on the policy direction needed for regional integration and long-term sustainability of surveillance systems. And also we have the GenPath Africa network to be presented, highlighting innovations and data systems that can strengthen genomic surveillance and complement wastewater and environmental surveillance. So my name is Poppy Karaoya, and I am a wastewater surveillance expert with the United Nations Environment Programme, and specifically working on the Wastewater Surveillance for Africa initiative. Now I would like to give the floor to Alex Pires, the Program Management Officer at the United Nations Environment Programme, or UNEP, for the opening remarks of this event, followed by my colleague Taru Miller, who will also provide the housekeeping rules of the event. Thank you.
Thank you, Poppy. And well, for all of you present here, my warm welcome to this third webinar series on wastewater surveillance for Africa. And today's topic is towards harmonization of wastewater and environmental surveillance in Africa, pathways and opportunities for synergies. So what we're going to see today is going to be a very important discussions on how collaboration can transform fragmented efforts into a strong unified system. And that's the powerful of that continental work that we are doing. This is not just about technology or techniques, it's about action. Each of you present here, and we had more than 200 registers, and the number is increasing of participants here, but each of one has a role to play in shaping the future where wastewater surveillance will safeguard our nature and our communities. And just a brief introduction for the ones that are not aware of the Wastewater Surveillance for Africa initiative. It is an initiative led by UNEP that works in partnership with more than 55 countries here in Africa and has many partners, including WHO, yearly, our collaboration with the Africa CDC, and several national and regional actors. That initiative it's possible due to the generous contribution of the EU Health Emergency Preparedness and Response Authority, DJRA, and we appreciate all the support and collaboration of our partners. But that initiative where this webinar takes place, has two aims. First is to strengthen the regional capacity for implementing and managing wastewater surveillance systems in African countries. And we do a lot of that through knowledge sharing. And the second one is to support the government and relevant stakeholders to plan, to establish, or to strengthen or scale up wastewater surveillance systems for the environmental and public health. All of that under the One Health framework. And what's the importance of harmonization? That fragmented landscape of wastewater surveillance systems brings some challenges for intersectorial and regional collaboration, and currently limits how countries can effectively detect health threats, environmental threats, and integrate data streams into the decision-making process. Coordinated, harmonized, and unified approaches can transform those isolated wastewater environmental surveillance efforts into a continental strong public environmental health tool. Wastewater environmental surveillance are rapidly emerging as essential tools for both public health preparation and response, as well as for ecosystem protection. Therefore, regional and continental harmonization of wastewater environmental surveillance approaches is crucial to ensure that data will be compatible, that it will be interoperable, and there is an effective cross-border or cross-region response to future threats. And this all happens under the wider African wastewater environmental surveillance strategy. The African CDC, as you're going to hear today, it's working on a continental wastewater environmental surveillance strategy for Africa. This will contribute, we hope that our initiative will contribute with technical perspectives, building some stakeholder networks, and supporting African countries in implementing harmonized approaches under that continental strategy. Yeah? As final remarks, you're also going to hear about the Global Wastewater Initiative. It is a free and open global platform, unique on its kind, that bring together institutions that are working to address the challenges related with wastewater beyond wastewater surveillance, but including wastewater surveillance. And by participating in that global network, those institutions have access to knowledge and access to other experts and work together looking for solutions and advancing sustainable wastewater solutions. So as Poppy mentioned, there's going to be three very good presentations today that you're going to be hearing. And they will collectively illustrate how harmonized frameworks, policy engagements, and technical innovations can support a robust One Health integrated system for wastewater surveillance in Africa. Has no doubt that this webinar is a very important step on that shared vision of an Africa where wastewater surveillance systems are regionally coordinated for resilience and shared increased capacity and knowledge to protect public health and ecosystems. So I invite all of you to engage actively in the discussions, share your experience, and explore where collaboration can lead us next. Thank you very much. Back to you, Poppy, or actually giving the floor to Taro, right?
Thank you very much, Alex, for your opening remarks. I will just quickly share a couple of housekeeping rules, and then we can dive into the presentations so that we are all in the same line. So this session is being recorded, and it will be used as part of the upcoming knowledge tool platform that we will launch. We ask you to stay muted during the presentations, so please keep your, actually all the microphones are at the moment muted, but if you wish to speak, then you can just raise your hand and we can unmute your microphone. You can use the chat for questions, share your questions or comments in the chat box anytime, and we will address them during the designated question and answer sessions during the agenda. And there is also the question and answer feature on right now, so you can leave your questions also there. And be respectful and inclusive. As Alex said, we are waiting for a very engaging discussions, but we also have to remember that we welcome all diverse voices and encourage respectful dialogue throughout the event. So just to keep in mind a couple of these housekeeping rules, and then I would like to actually give floor back to my colleague Poppy Karaolia, who is a wastewater surveillance expert at UNEP. And she's going to present about the harmonization of wastewater and environmental surveillance in Africa, universal guidance and opportunities for synergies. And after Poppy's presentation, I think there will be one more presentation, and then we will have a designated question and answer session for both of the presentations. But go ahead, Poppy.
Thank you, Taru. So the first presentation will focus on the presenting the UNEP document called Harmonization of Wastewater and Environmental Surveillance in Africa, Universal Guidance and Opportunities for Synergies. So our initiative, as Alex has very nicely mentioned, aims to support governments and relevant stakeholders to establish or scale up wastewater and environmental surveillance systems for both ecosystem protection as well as public health across all African sub-regions. What we aim to do is develop capacity, transfer the knowledge, provide tailored training, provide communication tools, as well as pilots at selected airports and ports all over Africa towards enhancing wastewater and environmental surveillance or WES strategies to build capacity, especially in low resource settings, as well as specific strategic locations, to contribute to the global data transparency and enhance collaborations among different stakeholders and among regions of Africa. Our initiative is generously supported by the EU Health Emergency Preparedness and Response Authority, and it is done in collaboration with partners such as the World Health Organization. So the first output focuses on harmonization of specific WES approaches between regions of Africa for both ecosystem protection as well as public health. What we aim to do is to analyze opportunities as well as the challenges in place towards wastewater and environmental surveillance systems in place and build capacity across African regions to share the lessons and approaches among stakeholders for both ecosystems and public health through the conduction of different regional workshops which take place at the moment in different regions of Africa to assess and propose harmonized approaches, which is the document and the work that will be shown herein, and enhance peer learning in Africa. The second output is focusing on enabling environments for coordination, good governance, and scaling up of WES, and includes training, the development of a continental roadmap, and fostering the endorsement of the developed roadmap by key African countries. The third output is the knowledge exchange, promotion, and facilitation through outreach on WES for ecosystems and public health, through our outreach and communication strategy, development of a digital knowledge tool, and dissemination of different materials that I'm sure that many of you have seen already. The purpose of this is to increase visibility, uptake, and replication of the project and wastewater and environmental surveillance in Africa and worldwide. The fourth and final output focuses on ports and airports, and specifically to enhance capacity for wastewater monitoring in aircrafts and port vessels in at least three airports and one port in Africa, to produce awareness events and increase the key stakeholder engagement in WES for airports and ports, and to develop a compendium of lessons learned and a roadmap on airport and port surveillance. What have we learned through this process, and how can we communicate the lessons that we have gathered? So the purpose of this document to be presented here is fourfold. First, we have the general guidance on harmonizing WES approaches across Africa. We also aim to capture and build on the collective experience of the African countries in wastewater and environmental surveillance. This is a huge topic. There is so much experience around, and we're trying to capture everything and put it all in one place so that we can learn from it and pass the knowledge to the next stakeholders and to the next level. Also, we aim through these lessons learned to create practical guidelines towards the alignment of the existing WES approaches and highlight opportunities for a collaboration and synergies. This is very important because through synergies we can move forward and increase our capacity for doing WES. We aim to increase collaboration and synergies between the sub-regions of Africa, but also between the public health protection and the One Health approach relevant stakeholders who are mostly involved in ecosystem protection. The final output and the final goal of this work is to enhance comparability of data across Africa, the reliability of results, and the usefulness of the generated data. So let's first see what is wastewater and environmental surveillance. Before we proceed with any alignment of approaches, we need to have a common terminology. So wastewater environmental surveillance is the surveillance of land-based sources of pollution, such as sewage, of sewer systems, or any other human-impacted environmental waters. There are some assumptions to be made. For example, environmental waters are relevant when there is low coverage by sewer systems. There is known input from human sanitation and hygiene activities, and there may be input also from non-human or zoonotic sources. Within the context of our initiative, wastewater and environmental surveillance covers both sewage and environmental water surveillance for public health purposes. For example, for the early detection of disease outbreaks, to track pathogens, detect variants, identify hotspots of disease, etc., and also to mitigate or prevent environmental pollution events that may lead to specific environmental deterioration or environmental health concerns. The bottom line is that WES can complement other surveillance systems and can inform water resource management, sanitation planning, as well as climate resilience policies. So why do we need to develop a harmonized approach to WES? Aligning approaches is a process of co-creation and not university. It must be rooted in African leadership, in collaboration and collective knowledge. We aim to produce adaptable and flexible guidance to support countries in producing their own comparable, reliable, and actionable waste data. It is important because we wish to enhance resource recovery towards the One Health approach. And we need to identify opportunities for synergies between public health and environmental, wastewater, water authorities, and to leverage existing resources and programs. How do we do this? We aim to achieve this through a highly participatory and inclusive process. For example, through the conduction of sub-regional workshops, consultations, technical exchanges. We aim to be gender considerable, and we aim to have equitable participation of women, youth, and underrepresented groups. We aim to combine a guidance tool with some flexible baseline on which countries can build on, especially in the framework of diverse contexts and capacities. Also, of course, we focus on integrating existing surveillance systems. For example, the polio surveillance systems were in place in order to enhance waste capacity. So the methodology that we have used is through the theoretical framework of the theory of change, which is a broad theoretical framework which explains how actions may lead to desired outcomes and impacts. We aim to explore through this work how logical sequence of inputs may produce specific outcomes and impacts that we wish to see. There are 6 different elements that we have included in this approach. First, we have the current status and challenges, or the baseline on which we can build on. Then we have the vision that we have and the desired long-term goals of our work, the proposed activities and actions, or the interventions that we wish to propose in order to bring about the change that we wish to see. The different pillars of synergies or collaboration that we wish to promote through this document, the benefits that may arise through the change that can be brought about, as well as any other open questions and the way forward after the end and the development of this document. So let's proceed to the first step of the process. First, we have the current status and challenges. What we have done first is we have tried to map the global wastewater and environmental surveillance harmonization initiatives and efforts. We have identified various global and regional initiatives in WES that include the majority of the countries in each continent, and we have also mapped the current global harmonization framework, meaning that we have tried to identify the available guidance in the world today regarding WES. However, of course, we are still working with our partners to make this list and these figures that you can see here more exhaustive. So we have a lot more to be included, and this list is currently being refined. The bottom line regarding this mapping is that implementation of wastewater and environmental surveillance remains largely fragmented worldwide among nations and sectors. There is a growing momentum, however, to bridge local practices with the global standards that are emerging at the moment. And also, global harmonization can enable coordinated responses and data comparability, as we have seen in within the framework of different global harmonization initiatives. So what are the main challenges that are being faced by the national WES systems at the moment? First, we have fragmented governance, unclear data stewardship, who owns the data, how will the data be used? We have weak data sharing between different sectors and between different stakeholders. Sometimes we have limited digital platforms on which the data can be entered and shared. We have, of course, unsustainable financing, and mostly there is reliance on short-term funding. There is a highly heterogeneous wastewater infrastructure and inequities in Africa. We have absence of standardized methodologies and protocols. There is a lack of Africa-specific frameworks in alignment with global systems. However, this is something that there is progress on through the Continental West strategy that will be presented later on. Of course, there is limited attention to environmental dimensions and the climate impact on the environment and on public health, and there is weak interdisciplinary coordination under the One Health approach. How can we tackle this? We have identified synergies and collaboration to be a key factor for success. How can we do this? We have to see wastewater and environmental surveillance as a bridge, bringing everyone together in the middle of the bridge. On the one side, we have the public health sector, and the other side, we have the water, wastewater, and environmental sectors. Everyone comes to the middle of the bridge during wastewater and environmental surveillance, and they share their expertise, their infrastructures, their methodologies, and their data towards a more unified approach under the One Health umbrella. What are the main benefits of providing synergies and collaboration between different sectors, but also between different regions? We have increased public health intelligence and data produced. So we have higher impact. We have increased One Health and environmental benefits, increased data quality, increased data comparability. We may have higher operational efficiency, improved policies and governance, as well as improved financing and funding across the board. So the pillars of opportunities for synergies have been identified as the different sectors of stakeholders that can collaborate within wastewater and environmental surveillance. For example, we have the public health and clinical sectors. We have the environmental, wastewater, and water sectors, the animal health, agriculture, wildlife sectors, the academia, research and reference laboratories that could take strong role within WES systems. We have the community and civil societies, the policy and governance, the donors, and of course the private sector that could also have an important role. So how do all of these actors come together to collaborate and synergize within wastewater and environmental surveillance? As you can see here on the right-hand side, we have different aspects of WES where everyone can come together. For example, we have the site selection and sampling, where the sites can be decided, prioritized, and mapped through the synergy of different stakeholders. We have the laboratory domain where also different stakeholders can come together to work towards WES. We have the post-analytic aspects, integration of health and wastewater data interpretation. This is something that requires extensive synergies and extensive collaborations in order to decide the optimum ways in which wastewater data can best contribute to public health outcomes. And of course, we have the global networks, which are very important, and the regional reference laboratories, which enhance sequencing capacities. They may provide cross-border networks and synergies. They may provide support for data interpretation for transport hubs, for example, and shared watersheds. They may provide the framework for common protocols as well as any interoperabilities. So the next step of the process that we have designed is to propose specific themes of activities towards WES harmonization. The first theme is WES prioritization and program goals. What we aim to do here is to provide guidance on one playbook, one data language, and shared quality rules that can be applied across African nations. How can we assure that there is public health impact during this process? We need to consider some parameters that make sure that the harmonization process takes into consideration the public health significance, the actionability within specific contexts, the feasibility of WES in local context. For example, is there site access? How are the logistics? Is there workforce available to do WES? And the sampling capacity. Also, we need to make sure that there is the social license from the community to perform WES in the community. We need to have acceptability. We need to have legal clarity of the process, as well as any ethical considerations must be addressed. Of course, we need to have sustainable and predictable financing and well-placed monitoring and evaluation tools for this financing to make sure that it is preserved and long-term. Multimodal WES surveillance can be placed alongside clinical surveillance to make sure that one complements the other. And of course, we need to consider the One Health approach, where we also should take into mind ecosystem protection and the status. So what we propose is 2 tiers of surveillance. This has been developed in collaboration with the World Health Organization and the already available guidelines, where we have the routine systematic wastewater and environmental surveillance at specific strategic sites. And then we have time-limited agile WES based on specific triggers. In order to incorporate One Health into WES prioritization and the definition of the WES programs within specific communities, we can add sentinel sites at the interface of livestock, slaughterhouses, and surface water catchments, which may connect WES to AMR. We may also monitor treated effluents or any other discharge receiving water or sources of key points of pollution that may support source to sea pollution control, safe reuse, and within circular economy goals. So these actions can be implemented within the regional and global WES hubs, for example, in regional organizations that perform WES. We can have a continental routine surveillance WES framework, which is specifically anchored to WES goals within nations and specific use cases. We can have a scoring matrix with published weights for parameter selection. And then we have the national WES programs and the transport hubs and border corridors. These are very important as we need to have harmonization within the national level, in the borders, and in the regional and global WES hubs. Of course, everyone knows Globacon, which is the network of networks and provides the the synergies and the collaborations at the global level in order to be able to enhance and support wastewater and environmental surveillance, specifically and the more within transport hubs and border corridors. Of course, where possible and where feasible, we can leverage the Global Polio Eradication Initiative assets in order to accelerate prioritization. For example, we can decide to use existing governance, sites, and data to provide the ready backbone to introduce additional priority targets and to maintain, of course, the polio system performance and stewardship. How can we integrate One Health in all of this? We can align with system priorities and goals within the broader One Health initiative so that surveillance outputs also inform environmental management policies continent-wide. And this could lead to an interoperable African network that can integrate environmental signals to generate comprehensive decision-ready intelligence, which can protect communities as well as natural resources. So next we have proceeded with the criteria for site selection and sampling. How can we harmonize this? We need to consider important parameters. For example, what is the public health risk profile for specific regions or areas? What is the population representativeness and coverage of specific geographical regions, the wastewater system in place, historical contextual data available, any operational feasibility or safety that should be taken into consideration, and the sampling procedures should be matched to the specific objectives. Here we have produced an operational guidance where specific sampling criteria are used and decisions can be made based on the context of each case. How can we integrate the One Health approach herein? We can use sampling points where the human waste intersects with natural ecosystems. We can provide common site selection criteria that can be expanded to flag environmental risk factors and not only public health hazards. For example, we could also monitor environmental waters that include cumulative industrial effluents or monitor habitats that have specific sensitivities to specific contaminants alongside public health priorities. Next, we have the analytical tool harmonization. Here we have used and would like to enhance the shared logic that aligns national capacity with interoperable and comparable outputs across countries. What we propose here is common criteria for selecting methods, aligned quality assurance and quality controls, internal controls and recovery markers that can be used by all, using a shared data or metadata language, as well as the promotion of regional synergies through pooled procurements, the conduction of ring trials at the regional level, sharing pipelines, and mutual recognition and sharing of knowledge. What we aim to do here is to provide a common minimum core of analytical tools and add contextual expansions without fragmenting comparability at the same time. So how can we integrate, once again, the One Health approach herein? We can use laboratory methods that simultaneously track both public health and environmental indicators. We can use samples not only to detect pathogens, but also antibiotic resistance genes, any chemical pollutants that are produced and discharged by humans. We can use common laboratory quality control and data reporting to cover both microbiological and ecological metrics. So what are the overall expected impacts and the long-term goals of waste harmonization strategies that we have just seen? We have identified that after the adoption of all of these activities that we have seen just now, we may have multiple benefits. These include capacity building, data sharing and policy integration, predictable funding and financing, the adaptation of existing waste systems into multi-pathogen waste platforms, and the integration of wastewater data with the epidemiological public health data and broader environmental data within the One Health framework. So these long-term impacts aim to convert the existing assets into common standards and shared capacity for the whole continent of Africa. So what is the way forward and what are the open questions that remain after the work done for the harmonized approaches and the identification of synergies between different sectors and between different regions? Of course, our goal is to call for coordinated transformation of waste in Africa. We wish to see a transformation from fragmented national waste systems into a coherent, interoperable One Health ecosystem, one that can be equitable, scalable, and inclusive of also non-sewage settings, and is, of course, anchored in African leadership, in shared standards and data and values. However, the open questions that remain and we wish to explore further are the following that you can see here. For example, how and what government structure can secure true One Health co-ownership of waste? How can we provide a minimum One Health data language for Africa? How can Africa build and sustain the social license for waste? What are the mechanisms that should be in place to facilitate transparency, protection of privacy, community engagement, and tangible local benefits? How should global and continental actors steward the continental routine surveillance scope in the face of climate shifts, of changes in mobilities, increases in mobility of people, as well as growing AMR signals? The next questions that arise are equitable representation beyond the sewers. How can we define sampling criteria in non-sewage settings? What are the trigger thresholds that could be ethical and actionable? And how can we set these thresholds for action for public health and environmental protection? We should also consider cross-border governance for both watersheds and mobility hubs, sustainable financing architecture that rewards harmonization, and to make sure that we set clear waste objectives in order to guide investment for greatest usable insights. And of course, we need to make sure that waste education is turned into competency in the future. How can we integrate waste knowledge into curricula, into credentials, into training models in order to provide continent-wide competency in waste analytics, bioinformatics, and in the One Health framework in general? So finally, what we would like to see after harmonizing and after answering the open questions that remain is how to turn waste into a multi-domain service to the people and to the environment, which supports public health protection, early warning of outbreaks, AMR stewardship, pollution control, safe reuse of wastewater, and climate resilience. So the next steps of our work include feedback, review, and improvement. This is a living document that feeds on the new information that is available every day. We are in the process of defining clear and concrete ways of action towards harmonization of waste in Africa. We are in the process of providing specific summaries for specific stakeholder groups to make sure that everyone is in line and informed about this work and how they can proceed to integrate this work within their line of work. We aim to perform stakeholder consultations and document outreach in the next few months. And also, we're in the process of defining how can this document fit into the African continental and global frameworks to support the work already being done. So next, I would like to thank you very much for your attention. I would also like to thank all the partners that have very kindly provided their feedback and input already, including the World Health Organization as well as HERA, and any other partners that shared their opinions and their contribution with us regarding this very important work. And thank you so much, and I look forward to your questions and a discussion later on. Thank you.
Thank you very much, Poppy, for the very rich and comprehensive presentation. I believe it woke up a lot of questions and discussion.
Oh.
And by the interest of time, I would suggest that if you could, Poppy, answer some questions that are in the chat or in the Q&A area. And then after the next presentation, we can have a discussion section. So maybe that's the way to move forward. So with that, I would like to welcome Emily Atuhere from the African Center for Disease Control and Prevention, Africa CDC, where she's working in the Division of Surveillance and Disease Intelligence. And she's going to present us about the overview of the continental wastewater and environmental strategy for Africa. So we are staying with the same topic a bit further. Emily, are you online?
Thank you very much, Taru, and thank you so much, the organizers, for having me. Can I first of all confirm if I'm audible? And can I confirm if my slides will be projected or I need to project from my side?
Yes, we can hear you and see you well. Do we have the slides, Poppy, or is it easier for you?
Yeah. You can share your presentation so that you can control it as you wish.
Okay, then thank you very much. Just a minute to allow me to connect. All right, are my slides visible on your side?
Yes, the slides are visible.
All right, thank you so much. Once again, my name is Emily Atuhere from Africa CDC. I'm going to give a very high-level overview of the continental waste strategy for Africa that we have been working on here at Africa CDC, but most importantly, in collaboration with our member states across the African continent, along with our partners and stakeholders from both perspectives, talk of the strategic partners, the funding donors, and all of the other players that are contributing in this space. So for starters, I will try to rush through my presentation, considering that we don't have much of time left. Allow me to give a brief background to why we are currently working on waste surveillance within the continent. If you are from the African continent, you must be familiar with some of the surveillance practices that have been conducted in most of our countries for quite a long time. But chiefly here, allow me to mention the integrated disease and surveillance and response strategy that most of our countries have been implementing for over 25 years. And this very, very important and useful strategy that has helped us as a continent in many ways has quite a number of sort of surveillance-specific approaches, which include the community-based surveillance, the indicator-based surveillance, the event-based surveillance, as well as the sentinel surveillance based on the priority or selected pathogens, as well as the disease or specific or vertical programs. What we have noticed over the years is that quite a lot of our major and prominent surveillance systems in the continent are based on clinical surveillance, meaning that they actually have some challenges and limitations when it comes to the picture that we would like to see from a population level. One, we have challenges with the health-seeking behaviors of our population in the continent, which is not so not so good for several reasons. We have challenges to do with healthcare access due to the different variable reasons in the different geographical settings, some of which, of course, are to do with financial access. And then a lot of our surveillance data actually depends on clinical suspicions as opposed to lab tested and diagnosed results. So this poses us with limitations of delayed detection of outbreaks, limited integration of surveillance data in terms of how do we get all of these packages into a One Health approach. And we, of course, have noticed over the years as we respond to the different public health emergencies on the continent that we really have a common phenomena of delayed response. And we would like to have this improved going forward. We also have seen an increased impact of public health emergencies from preventable causes, chiefly because of these challenges that we have seen. So as Africa CDC, we have been working towards strengthening surveillance ecosystem for early warning in the continent. And here, allow me to just highlight one piece of work that we did about 2 years ago, mainly to help address the urgent need for population level surveillance and for early detection and rapid response of public health emergencies. So in 2022, Africa CDC undertook an exercise for prioritizing the pathogens in the continent that have been observed over time to be the leading causes of the many epidemics and outbreaks that we have responded to. So this prioritization exercise was, first of all, aimed at supporting the development of core capacities within our member states so that they are able to prepare early and be able to detect and respond rapidly to any public health emergencies at any time. So when we look at some of the pathogens that have been highlighted in the risk priority pathogen risk ranking exercise, we note that quite a number of these are actually detectable in wastewater. Talk of polio, virus, SARS-CoV-2, measles, mpox, and of course, many others. So coming back to the wastewater surveillance, the question is why wastewater and environmental surveillance in Africa now? As already highlighted by my previous speakers, waste is a transformative tool for early detection and prevention of public health and environmental threats. And we have seen this evidence broadly, both at global and within the continent itself. It is also non-invasive, it's cost-effective, it's a scalable method for monitoring population level health. We have seen its proven use in polio, in COVID-19, and also in cases of AMR monitoring across the different populations of the world. So when it comes to Africa's challenges, we believe that waste is really very key and crucial in terms of adding to the tool of surveillance intervention, the toolbox of our surveillance interventions for purposely addressing recurrent disease outbreaks and where we have challenges of rapid urbanization that comes along with its own challenges for public health, rising antimicrobial resistance, environmental degradation. All of these are key examples where we believe that waste would play an important role in improving the health of the public within the continent. So when it comes to our contextual space as a continent, we do have challenges and opportunities. And I would like to mention that we have seen this featuring quite a lot in many convenings and many consultative meetings that have happened across the continent. Some of them led and convened by Africa CDC, others by our partners on the continent and on the globe, particularly here mentioning the GLOACON network. So in terms of the opportunities that we have seen in Africa, we've all appreciated that there is a strong polio surveillance foundation that we can build on to expand waste within the continent. There is also expanding genomic sequencing capacity and public health lab networks, as we have seen in the recent past, as some of the good effects that we inherited from the COVID-19 pandemic. We have also seen that there are quite a number of successful pilot projects that have been implemented on the continent that have demonstrated the usefulness of waste within the continent, especially around the areas of SARS-CoV-2 and mpox surveillance. However, we still note that there are many challenges that we need to address, and we need to sort of streamline for us to be able to scale up the use and implementation of waste. And these include the fragmented protocols that we have seen used across the different pilots and initiatives, the limited technical capacity. Overall, in Africa, we've not really implemented waste as an institutional or a national level kind of surveillance. And we need to start thinking of how do we build the capacity if this is going to be one of the tools that we want to use. Weak data integration has already been mentioned by my predecessor, but also insufficient financing for waste is one of the other challenges that we see across the continent, mainly because a lot of the interventions, a lot of the good lessons that we have learned are actually within the context of project-funded initiatives, which are short-term lived, and we would like to have sustainable programs or implementation that can be able to contribute to public health improvement. So from these interventions that I have mentioned, the different consultations across the continent and the different convenings that have happened, we have received quite a number of very clear strategic and priority actions that we need to focus on if we are to scale up waste in Africa. We have quite a 6-point program, like we call it here, and firstly, we have received a recommendation from the different convenings and consultative meetings that to develop a strategic document for the continent that highlights the vision and the direction and the scope of wastewater surveillance as we would like to have it done within Africa. It is important that there is local ownership, there is local leadership, and this is going to be very critical as we work with member states to develop the strategy so that we can be able to have an integrated waste program in each country, but also a sustainable program. If I can just summarize the rest, we have received recommendations to continue on the innovation side because there are questions that still require to be answered within small project settings, and then increasing resource mobilization across the continent to support this work is one critical issue that has come out as a recommendation. Capacity building cannot be overstated because this is critical to the entire work that we are talking about. And then aside from conducting meetings so we can be able to exchange information and learn from the existing work that has happened in the different regions of the continent and the world at large, we have been requested by our member states that we need to have a clear coordination mechanism that we can use and leverage for waste coordination at the continental level. And we have already started work on some of these points that I have mentioned, as I will highlight in my next slide. Before I highlight on what the progress we've made, allow me to dive deeper into the continental strategy that we have just seen as one of the key recommendations we received from the different engagements. We have started work on the continental strategy development. It's in advanced stages. I believe some of us here on this call have participated in our consultative meetings towards the development of this strategy. And we do continue to engage with our member states and partners and other stakeholders to ensure that we have an inclusive document that reflects the local context and the local leadership in terms of wastewater surveillance. So in terms of the core objectives that the continental strategy seeks to address, the first one is to establish a continental waste system that enables early detection and response to public health emergencies or threats, to integrate wastewater into a national and One Health surveillance systems. This is at national level. We would like to see waste feeding into the public health surveillance system or ecosystem that we have already seen is mainly dependent on clinical data. We also have an objective mainly to use waste to monitor environmental health and climate resilience, to embed ethical, equitable, and community-centered practices within our waste programs, to strengthen technical, laboratory, and workforce capacity, as well as sustaining financing and ownership across the regions of the continent. So in terms of the strategic pillars of the continental strategy, we have 7 strategic pillars that the strategy addresses itself to. These range from equity, inclusivity, to sustainability, to data transparency and actionability, capacity building, One Health integration, regional collaboration, as well as ethical standards. In terms of our vision, we would like to ensure that we have a resilient Africa where wastewater and environmental surveillance drive early warning, health security, and sustainable development. And so now, in terms of the next steps that we are looking to do, we have our 6-point program that we are following through methodically to ensure that we build capacities, but also we deliver on the different recommendations that we have received from our member states. But in the short term, we are looking to finalize the strategy, which we hope to launch within the first quarter of next year. But before we do the launch, we will have one more validation meeting, which is going to be quite big because we would like to have all of the continent represented and the different stakeholders from the different relevant ministries at national level. We are also looking to continue capacity strengthening. This we have already started from previously during the COVID-19, but we look forward to leverage on some of our existing networks to build regional hubs and spokes where we will be able to build sustainable capacity strengthening for our member states. Because of time, I may not have to go much into this, but we look forward to having regional hubs that will provide support to the different countries in each region, thereby helping us to cover the continent, but also build a sustainable structure for waste surveillance in the continent. We are looking forward to establishing the Waste Consortium, and this will be mainly early within next year, because we believe that having a coordination platform where all of the key stakeholders and the different work happening in the continent will be coordinated is a very, very important step for us to have. And it's the reason we are here today, because as you can see, there is a lot of collaborative work happening. We have UNEP and all of the partners represented here, and we would like to have one platform where we are able to coordinate all of these initiatives, all of these interventions, and ensure that we harmonize the support that we are giving to member states in a very seamless manner. And lastly, we continue to encourage and look forward to support pilot implementation of waste in our countries, specifically to answer some of the key questions that will be important to our strategy as a continent, because we know that waste is a surveillance tool that you cannot, implement just as it has been done elsewhere. It is context specific. It responds to local and different geographical differences. And so we would like to continue a few piloting interventions to help us answer some of the surveillance questions that have not yet been fully answered. And one of these is how we can be able to integrate the waste data into public health surveillance. This is one key question that we would like to answer with some of the priority pathogens, so that we can be able to provide clear guidance for how countries can go ahead to implement waste within their setting. With this, allow me to stop here, and thank you so much for your audience and for having me. Thank you, and over to the moderator.
Okay, I think it's for me now to pick up with a very brief Q&A. We're a bit over time, but we do want to dig in a little more to this. My name is Kate Medlicott. I'm the Sanitation and Wastewater Team Lead at WHO. And I just would like to start with one question to you, Poppy, and triggered by Jerome in the chat, who's asked the really fundamental question, like, what do we mean by harmonization in this context? What are we defining it as? And maybe just starting from the beginning of the process at site selection, you talked about sampling treated and untreated wastewater, thinking about pathogens as well as like ecosystem and environmental endpoints. Could you comment a little bit about what you see as some of the, well, you talked about the opportunities of harmonization, but maybe some of the technical challenges and trade-offs associated with harmonizing sampling sites for multiple surveillance objectives and outcomes?
Thank you, Kate. So harmonizing in this context is basically providing a baseline on which different contexts and different countries and stakeholders can build on. So once we provide a guiding baseline, which is the very basic wastewater and environmental surveillance program that most of the countries or most of the laboratories can perform. From there, there is the capacity to build upwards and expand the surveillance systems to, for example, more targets or more sampling sites, or increase the types of surveillance that can be done. So what we wish to provide with this harmonization document is not how to do things, but what is the minimum data that can be produced through this process, and how can this data be comparable to other countries or other laboratories that could be doing similar work. So I'm not sure if this defines what harmonizing is. And of course, within the African continent, we have so many different contexts, so many different capacities, and the variability, which is difficult to approach. And this is why we cannot provide information on how everyone should be doing things. But it is important to provide a threshold on which people can build on and develop their capacity for doing WES. So this is my response to what harmonizing is. Can you repeat the second part of the question, please?
Yes, it was in relation to trade-offs
Yeah.
when it comes to sampling site selection. But I see Alex has his hand up. Alex, did you want to come in with something before we move to Emily for the next question?
No, it's good. Maybe, Poppy, we could invite the participants that are interested in providing comments or inputs to the current version of their harmonized approach guidance to reach out to you, because this is not only a document, it's a process where many people has been consulted, and it's not going to be the definitive harmonized approach for Africa, but it's a harmonized approach. So as much as interested and capacitated people is willing to provide the comments at this stage, I think that it's good for that consultative process.
Thank you, Alex. Yeah, indeed. Actually, we're planning to have a consultation meeting within the next couple of months with the national stakeholders and representatives of WES systems. So I would like to extend the invitation from now, and of course we will provide with the official invitation later on to anyone who will be interested to provide input and help us to develop and further refine what we mean with this approach. Of course, this is not something that will be prepared and that's done. It is something that will be continuously refined, improved and developed based on the knowledge available and the information that we have in front of us. So yes, indeed, very good comments. Thank you so much for all the feedback. And just to let you know that we are currently taking everything in and we are considering it during the next stage of the document development. So thank you so much. And regarding the challenges that Kate has asked, indeed, we have a lot of challenges, especially when it comes to SWORD and non-SWORD settings. Of course, it is not the same thing doing wastewater surveillance in SWORD settings and non-SWORD, and this is why the non-SWORD settings is one of is something that we wish to approach in a different way so that we are inclusive and fair when we're doing wastewater and environmental surveillance. So this is something that we're currently working on, and I think that we will have a much clearer vision in the next few days about this specific topic. Thank you.
Thanks, Poppy. Indeed, this what is harmonization and the level of ambition of harmonizing across so many targets and objectives is a big one. I think this is a useful input to the Africa CDC work. So I'll turn to Emily now with just one quick question, which is I'm sort of curious about, you work in Africa CDC, you work with all of the public health agencies across the region, and certainly from the WHO perspective, what we see is quite often approaches are siloed around specific diseases or groups of diseases, and the way that wastewater surveillance is perceived by those public health counterparts can be quite variable, and in terms of how they interface with established surveillance systems, whether they're a complement or in some cases competition. Could you comment, Emily, a little on the kind of feedback you're getting from your public health colleagues who may be less convinced of the usefulness of WES and where they're at in terms of their sort of willingness to integrate this into their disease strategies?
Thank you very much.
Oh,
yes.
There you are. Yes. Go ahead.
Yes. Thank you so much for that very good question. So I think when it comes to wastewater surveillance and how we have traditionally practiced surveillance, especially within the continent, there are levels of integration across the systems, across the data. But it is also important to acknowledge that the integration has been evolving over time. if you look at the integrated surveillance and disease response strategy, when it was first designed, it was intended to sort of close the gap or narrow the gap between the vertical program surveillance systems that were sort of the majority or the mainstream way of reporting different disease or indicators to do with public health. So with the IDSR, we have gradually seen a really good progress in terms of integration, but this is still an evolving concept. Because if you look at this sort of integration, it's mostly around clinically based surveillance. And so now I see us as taking the next step of integration and evolving to ensure that our environmental surveillance data, particularly waste data here, is integrated within our surveillance dashboards. It is part and parcel of the ingredients that national public health institutes and ministries of health teams are routinely evaluating, in addition to the other surveillance data that is available on the continent. We also must understand that this is not a surveillance system that we have really implemented broadly in the continent in our history, save for the polio surveillance, which also provides us very, very good lessons to build on. So I believe that as we take this work forward, it's going to be more of a country-specific approach. What does the context look like in each country, and how does waste fit into their ecosystem of surveillance? I think that's going to be very, very important, and that's how we look forward to engaging with our member states so that every country is able to define the objective for which they are implementing WES and how they anticipate for this tool to improve their existing surveillance. Thank you.
I like that a lot. Thank you, Emily. I think describing this kind of journey we're on and the need to kind of meet those different disease communities where they're at, understanding their surveillance needs and really coming with the evidence on where WES can support that. Okay, I think we're really up against the clock, so I'm going to hand over now to our third presenter, which is Samuel Oloya, from ILRI, who's going to be talking about the GenPath network in Africa. Over to you, Samuel.
Okay. Okay. Thanks. Thanks, Kate. Let me see if I can put my slides on. Okay, I hope the slides are on. Are they visible? Maybe just to confirm.
Yes, thank you.
Okay. All right. So yeah, I want to start by thanking the UNEP for inviting me to make this presentation on wastewater environmental surveillance for Africa and looking at the how the GenPath Africa network is also contributing to this. Before I get into that, I just wanted to also add my little comment on the harmonization and standardization discussion, and really wanted to say that at the moment, given that the momentum that WES is been generating over the few years, I think there's a lot of fragmentation here and there, and I think harmonization is really coming handy at this very important moment, because we really need a unified continental framework for reliable, comparable, and actionable environmental surveillance data. And I think that the harmonization is really critical in enabling cross-country comparison and coordinated response. It will also really improve our confidence in the quality of data that we generate, because As you know, we're talking of siloed mini projects here and there that are also focusing on waste, but we really don't know what quality of data that is coming from there. And so it will also create a shared foundation for this early warning system that we are all, you know, waiting to see from wastewater. So the 4 pillars for the harmonization framework, I think, as mentioned earlier by Poppy and also with Emily, I think from my perspective, I think focus should be taken to the aspects of field sampling and management, laboratory analysis and the QA, data analysis and reporting and interpretation of that data, and also how we're reporting those to the to public health for public health action. So I think if we focus on these things, we will be able to achieve that harmonization that we need. But I also wanted to make an earlier caveat that for us to come up with what we would call an harmonized or a baseline, there's a need for us to really do some level of research to be able to develop tools that are verified and that can be, you know, used across different settings, as has been mentioned. So currently that is lacking, and that is a key area that focus is needed to. So coming back to the GenePath Africa that Poppy asked me to talk a little bit. So this is a project that is supported by the Global Health EDCPT3 joint undertaking, and its members, as well as the Gates Foundation. So that is the partners that are funding the GenePath Africa project. So GenePath Africa is a consortium of different research groups that have been put together through that funding. And a number of our consortium partners are from South Africa, but also a few from Europe. So we are talking of the University of Antwerp, and also Link, who is our manager for this consortium, is in Germany. So in South Africa, we have a number of groups, mainly from Stellenbosch University, and also from Mozambique, where we have another team all together forming this GenePath Africa team. So myself, I lead a work group which is based on One Health. We co-lead this with Professor Michelle Milner, and we focus mainly on the One Health aspect of this work. So the consortium, GenePath consortium, aims to increase the use of genomic epidemiology across Africa and to answer critical public health questions. We also aim to create a data platform through which integrated epidemiologic, clinical, and genomic data can be collected and combined. And we also working towards the implementation of selected pilot projects that apply genomic epidemiology to specific disease areas, and also use these results to inform public health decision making and product development. A critical aspect of the consortium also is involved in the establishing community of practice, which will be involved in training programs and fellowship opportunities in genomic epidemiology on the continent. So those are some of the key aims of this consortium. But so coming to how we contribute to the waste. So as part of those pilot programs that GenePath is also supporting, we got involved in the One Health aspects, and we decided to be performing wastewater environmental surveillance as part of the pilot projects that the GenePath is supporting. And for the wastewater environmental surveillance, we started this in Kenya, and we selected 2 sites for the piloting of wastewater in Kenya. And this is, we covered 2 important cities in Kenya, so Kisumu and Mombasa. And these 2 cities are interesting because they juxtapose a large water bodies. So Kisumu is a city that is next to the large clean water body, the Lake Victoria, and also Mombasa, which is bordering the Indian Ocean. So earlier on in establishing our wastewater surveillance in these 2 cities, we first of all started by designing how we are going to do our sampling. And this was not a very simple task. As you know, now we are critically talking how we can harmonize even our sampling. So earlier on, we decided to work with water and sanitation companies that operate sewer lines that run and manage the sewer lines in these cities. And our task here was to work with them to identify sampling sites that are connected within the sewer networks, and also select sites that bring convergence of these lines that cover a specific size of communities or population. So it was a mapped exercise that involved the managers of the sewer system in the city, so that when a site is selected, it is clear that the wastewater that goes into that is covering a specific community, so that anything that we detect in that wastewater can be traced back to where is possibly coming from within the community that is covered. So as you all know, analyzing wastewater can be very tricky and complex, and I think what innovations that are now currently out there are mainly two approaches. So one is the targeted approach, where we focus on specific pathogens, and of course this is quite advantageous in the context that we can really narrow down into a particular pathogen and cover quite a significant portion of the genome in terms of identifying and characterizing what we have got. It's also relatively sensitive because the targeted approach is removing a lot of background information, but it also has limitations, several limitations in terms of target pathogens. As we are talking of wastewater as an early warning system, it's important that we also have an idea of what we actually don't know that is circulating in the environment that we want to pull out with this system. And so when you are doing targeted, we are only focusing mainly on what we know it's there. And then it also requires that you know that the pathogen that you are targeting, particularly when we're looking at the detection methods that involve the DNA and RNA, etc. So this is a targeted approach that is also useful but has limitations. The other approach is using the metagenomics, and this one is whereby we may not have the luxury of covering a large portion of the genome because of the complexity of it all, and also the aspect of sensitivity. But it has the advantage that it gives you a picture of a broader aspect of pathogens that you can detect, and including those that are emerging, and also those that you would call the pathogen X. And also it doesn't require you to know what pathogen is it. You can, it's a non-bias method whereby no prior knowledge is needed. And as you sample your wastewater, you extract the total nucleic acid and analyze that, you are able to see what is within your complex sample. So for our part, we've been mainly focusing on the metagenomics aspect and trying to develop this tool, making it as suitable as possible in terms of even cost effectiveness. So this is the area that we have been developing for quite some time. So just a few slides here to show some of the data sets that we've been generating. The fact that we've been generating, we've been sampling longitudinally for quite some time, we are able to see a very interesting picture of some pathogens. So here I'm just picking maybe just one pathogen, but we're doing this for several other pathogens. For example, the MTB here, we are able to look at the profiles of these pathogens with time after a very long time. And as you can see from the picture, the image that I'm showing there from Mombasa and Kisumu, you can see that MTB is more or less endemic in these cities, and so it's only important that we understand, for example, if say in cases whereby vaccines will be introduced, we can actually now use this information to tell us whether the vaccine is working or not, because from wastewater we can see how endemic the pathogen is within the communities there. We've also been looking for other pathogens like Mpox. We are also able to see signals. And as you can see for Mpox, you can see clearly that it's seasonal. There are times when the signals are quite high, and then also periods where we have very few signals that we can pick at different sites there. So you can see the power of metagenomics and looking at the profiles of these pathogens over a long time. It gives you a big picture on what is happening within the community at specific times. When I bring in the one other pathogens here, this is Vibrio cholera. And as you can see, we've also seen very good profiles of signals across the two cities, Mombasa and Kisumu. And as you can see, there's quite a lot of Vibrio signals we are picking in Mombasa. And based on our discussions with the public health, it looks like we have several many sporadic cases of Vibrio outbreaks happening within these cities. And one thing I wanted also to show here is that, for example, if we look at the signals that we've been seeing in Kisumu, there is a time when we were trying to see signals flaring up, and that coincided exactly with an outbreak that was publicly announced in April this year. And we had started to see those signals coming up slightly earlier before the outbreak was announced. So the power of wastewater is exactly this way of giving us an early warning on what is within the population, and we are really seeking to develop this aspect in a much more efficient way, and how it can really feed into the public health system. As we've said, in the context of One Health, we're not only picking human specific pathogens, but some of the sewer lines that we are sampling also include sewages that are coming from slaughterhouses, etc. And from these ones, we are actually happy to see that we can pick signals from things like foot and mouth disease, which are not necessarily coming from human, but from animal. Now bringing that context of One Health. We are also, the other advantage of the metagenomics approach is that we are also receiving, as we analyze the data, we are also picking quite a lot of antimicrobial resistant genes. And with this, we are beginning to develop a platform where we can detect AMR signals and relate this with what is happening within the community. So another advantage of the metagenomic approach is also to bring the aspect of antimicrobial resistance, which might be quite difficult if we go through the targeted way only. So as we develop these tools for wastewater within the country, we are also not doing this alone. We are working together with stakeholders. So for example, in Mombasa, we are working with public health, and in Kisumu, again, very closely with the public health within the county. And one thing that we do is that we have very regular meeting whereby, as they support us in sampling, and when we analyze this data, we have an agreement to actually share the data that we are generating with them, and to a large extent, they are actually helping us to actually interpret some of the signals we find, because they have access to some aspect of clinical data that we currently don't have. And I think our conversation is helping us really to refine our system and to help us really understand the utility of wastewater in the context of public health. So coming to the gene path and how the gene path works within the wider UNEP. So GenePath Africa is part of a wider genomic epidemiology network, and this UNEP network is also a combination of a much larger network of several consortiums that were also funded differently. And so here we have networks that includes ODIN, Pangene, Epigen, etc. And together, these networks are collectively working. They are collectively coming up with initiatives that aim to build a resilient, integrated, and standardized public health genomic ecosystem across Africa. So not all of them are working on wastewater, but all of them are focusing on the genomic epidemiology, focusing on pathogens within the continent. And so within this UNEP network, which GenePath is part of, a number of them are working on wastewater. So GenePath Africa is part of this, but ODIN, EPGI, FAGE, and Great Life are more involved in the wastewater projects. So within the UNEP network, we co-lead the wastewater working group, which we are all coming together to be able to coordinate how we do wastewater surveillance within the UNEP programs. So within this working group, we recently started to generate some small survey to find out how the different countries where wastewater is being implemented currently, to understand how they are faring, the status of wastewater in those. And we posted a few questions to them, like, for example, if there are any training courses on wastewater, and whether those programs take into account the issues of ethical considerations, etc., and whether they are also a part of different working groups, and also the aspects of the aspects of capacity building within the countries where those small projects are being implemented. As you can see, the response here was when it comes to training, there were no training happening. Very few are having training aspects, and when we are asking whether what would be the main gaps, and a number of them are touching on the training, and also the aspects of involving ethical consideration in their work. So this is just a preliminary finding that we saw, but the key thing is that there's a need for training courses to cover aspects of bioinformatics in waste. And this is coming out very clearly when we are talking of harmonization of waste in the continent. These are the key areas that we need to focus on in our ability to harmonize waste within the continent and beyond. So when it comes to training, we as ILRI, we have been conducting several training on genomics and pathogen genomics. And of late, we have incorporated quite a number of training modules that cover wastewater. And we have done quite a number of training with collaboration with Africa CDC and ASLM. And so this is something that we are continuing to do, and we hope that we will at some point also contribute to the harmonization of wastewater within the continent. So in conclusion, the UNEP, where the GenePath consortium falls in, collectively is an initiative that is seeking to build a very resilient, integrated, and standardized public health genomic ecosystem across Africa. And this network is moving beyond the traditional silos of disease controls, but establishing what is proactive, that is multi-pathogen surveillance platforms that is capable of rapidly detecting and characterizing existing and emerging health threats. And crucially, we're also including the aspect of antimicrobial resistance. So that is all I could say about the GenePath Africa and how we integrate with UNEP and how we can also be a critical part in harmonizing wastewater in the continent. Thank you very much.
Thank you very much, Samuel, for the very, very good and enlightening presentation, both covering the GenPath project and also the UNEP network more widely. I think we're a bit over time, and apologies for that, but as it's a very fascinating discussion and questions ongoing in the chat also, I would like to give floor for a couple of those. So I see there is one hand raised. There is Timothy, or is it do you wish to have a question, or let me try to, oh, okay, the hand is down, okay, great. I picked up a couple of questions from the chat, so for Vibrio, this is, I think, for the GenPath project. So for Vibrio, which part of the virus have you picked up with metagenomics? Do you have any more details about that?
Yes, so with the metagenomics approach, we basically collect these samples and sequence using shotgun metagenomics. And the reads that we obtain from those are the ones that we are using to assign taxonomies. And most of those that we pick that map to Vibrio cholera, we then use that as a signal to define Vibrio in the system. Now, we are getting deeper to analyze those reads as to whether they are covering some of the key signatures for clinical Vibrio. And that is an exercise that we are currently doing. Yes, so a number of them are mapping on clinical, on sequences that are signatures of clinical Vibrio, like 01, 0139, etc. So those are some of the analysis that we are doing for a number of pathogens, not only Vibrio. I'm just showing Vibrio there, but we're doing that for Klebsiella, and many other pathogens that we pick within the wastewater. Yeah.
Thank you. That's very interesting work that you're doing. I see that the metagenomics is waking up more interest, so I will just pick one more question, and then maybe if you have time, Samuel, afterwards, I think there was one more question after this in the chat. So could you clarify your WES metagenomic objectives? Is it principally knowledge generation at this stage rather than surveillance with actionable data?
Yes, so I do understand that metagenomics approach for wastewater is currently still relatively an expensive approach that may not be used for routine surveillance. But the initial objective is to use this at initial stages to identify pathogens that we can then focus or target using a targeted surveillance. And so what this is helping us with is that it helps us also to generate critical reagents and tools. For example, the reads that we receive from various pathogens there, we can use those reads to actually now design targeted tools for monitoring specific pathogens. But developing a metagenomic approach that is cost effective is also critical in detecting what is unknown out there. Now, we want to keep this technology alongside the targeted approaches which can be used, deployed more routinely, so that as we do routine surveillance using relatively cheaper PCR-based targeted approaches, the same sample, when there is an interesting signal in there, we can actually subject that to a metagenomics and even get a much more context and wider information on the pathogen that we are looking at. So yes, it is not, our target is not to use this routinely for routine surveillance, but it is a tool that we need to keep sharpening, so that occasionally, maybe once in 3 months, etc., or as the cases may demand, we can really bring it out to give us a better picture of what is happening within the community. Yep.
Thank you. Thank you very much for that answer. And I believe there are so many different tools in this area, and all of them are contributing in their own ways. With the interest of time, I see there are a lot of discussion and questions still coming to the chat, but if all the presenters have time to answer those, it would be great. But we are happy to see so much discussion ongoing, and it's a sign that there will be a room for this webinar series in the future also. But at this point, I would like to give floor back to Poppy to finish up the webinar.
Thank you, Taru. So first of all, I would like to thank the speakers for their excellent presentations, for providing very useful insight into the continental strategy, as well as the GenPath project, which has provided some very good activities towards harmonization of wastewater and environmental surveillance activities. Thank you so much for your time and contribution. Also, thank you to the participants for being here with us, even a bit over the time. Finally, I would like to ask you to respond to the survey that was just posted in the chat now. We would like to know more about your experience during today's webinar, and these responses will help us improve and refine the content and structure of our upcoming webinars, as well as of our work. Your opinion matters to us, and we have noted everything that you have provided to us down. And thank you for taking a few minutes, even after the end of the webinar, to respond to the questions. Finally, thank you to everyone. Your insights have shared some highlights on the growing momentum towards stronger, more coordinated and sustainable wastewater and environmental surveillance on the continent. We encourage you to keep engaging with us and supporting these collective efforts as we shape the future of West in Africa together. Finally, we wish you a nice afternoon and hope to see you again in the next webinar and in our next activities, which will follow soon. Thank you so much, and we will be in touch. Have a nice day. Thank you. Bye-bye.
Bye-bye to you all.